From Middlesex, Ms. Jehlen.
Thank you, Madam President. I'm not going to repeat the arguments of other proponents of this amendment. I think that everybody in the room and everybody in the Commonwealth agrees that the costs of health care and insurance are unsustainable, and this bill takes important steps to control the cost of health care. But it doesn't do anything, in my opinion, to control the costs of insurance, and I'm going to talk about that a little bit. I wanted to go back to what the chairman of Healthcare Finance said in introducing the bill, which is that the bill provides for evaluation and course correction. This is an attempt to carry that principle forward, that we evaluate compared to something else, to another means of controlling costs. It doesn't ask that we compare our health care system to that of Canada. It says, what if we had a different means of raising the resources to pay for health care against a different means of raising those resources? It doesn't change the health care delivery system. It doesn't change the health care system. It could easily build on the accountable care organizations that are anticipated in this bill. Let me add that it would not be as big a transition as it would have been in the past. Right now, most of the cost of health care in Massachusetts and the United States is picked up by government sources. They're conflicting, they're confusing, but they are government payers that pay for most of the health care in the Commonwealth and in the United States. Not only that, the portion that is paid by the state is crowding out the costs, the expenditures for other things we need. And I think this year mostly, frankly, about transportation, which we have failed completely to maintain our transportation system. So I would just reiterate that the difference in this bill, which does important things to control health care costs by electronic medical records, by coordinating care, by preventive care, by changing the malpractice system. Those are very important, and we took a few years ago an important step in controlling the cost of insurance, where we're ahead of most states in setting a minimum medical loss ratio for all health insurers. But that, in my opinion, is not far enough to go in controlling the costs related to insurance, because, for example, medical loss ratios do not include the costs to businesses of dealing with health insurers. It doesn't include the cost to providers in all the different billing systems that they have to deal with. So I just want to reiterate that this amendment goes to the cost of insurance as opposed to disrupting the health care system. Let me just mention the ones that I have in my mind. We have multiple CEOs for every different insurance company making multi-million-dollar salaries, and when they fail, they're given multi-million-dollar payouts at the cost of people who are paying, they thought, for health care. There's the duplicative billing and payment services, but a big cost we don't talk about is that they don't control costs, they shift costs. We all know that public payers underpay, but guess what? It shows up in the cost to private payers. All of us know that insurers are moving to move more and more costs to the consumer. We know in our own experience and that of our constituents that insurers routinely reject claims. This doesn't mean that nobody pays in the long run. It means that the provider pays because they go without payment, or the consumer pays for a while, or the consumer pays because they received a bill and paid it, not knowing that they could get the insurer to pay it. And finally, the current system, because there's so many different insurers and so many different rules, and you have to change when you change your employer, it creates transition costs that also slow economic development. So I just want to reiterate, this bill is important in dealing with reducing some of the unnecessary spending on unnecessary medical care. But it does not deal with the cost of insurance, the many costs of insurance, not just the direct costs. So it allows the Institute, created here, to report on a comparison not with Canada, but what if we had a different payment system for the healthcare system we have here? And if it turns out to be less, then it doesn't make that happen. It presents a proposal to this legislature which decides, is it worth it to save that much money, however much it is, to change the payment system, and it would have to propose a payment system. Now, Vermont doesn't even have a payment system in place, but they're proceeding along a path that will allow them to have a proposal which they will then vote on. They're not on a track that is heading downhill and they can't stop. They can stop at any time, and so could we. So I ask that we please adopt this amendment, which I believe is consistent with the opening statement of the Chairman of Healthcare Finance, which is to evaluate and course correct. So I hope this amendment is adopted, and I thank you, Madam President.